Diabetes places a huge burden on individuals and health systems around the world. Israel provides a powerful example of taking systematic early action to tackle this. During the 1990s, changes were started that shaped policy and impacted behaviours of individual doctors, guiding how they treated their patients with diabetes. The impact has been significant.
So what happened is that in Israel, the government understood, the Ministry of Health understood, that they can take leaders in the field of diabetes, give them a backup, and just send them to do everything by themselves with some support. And with this, things works wonderfully.
Between the years 1997 and 2007, we have seen an increase in the proper monitoring and screening of diabetes in Clalit from rates circa 40% to almost 90% of our diabetic patients. When the OECD performed in 2009 a comparison of hospital admission for uncontrolled diabetes, Israel had by now one of the lowest rates of all OECD countries. The impact on the life of patients is obviously tremendous.
Behind the story of reduced hospital admissions is a year-on-year increase in the proportion of people with diabetes achieving their targets for control of their blood sugar levels, and a reduction of those significantly out of control. This improved performance hasn't just helped patients, it has brought down the average per person cost to the health system by nearly 30%.
If you really want to make a difference, to have a national plan that is being backed by everybody who have interest, and to have together with this plan the action items and the budget that you need.
Israel's approach includes a significant commitment to educating doctors, sharing latest knowledge, and building expertise among primary care physicians. Alongside this, pursued actively by health insurance companies such as Clalit and Maccabi, is dedication to enabling clinicians to make early and informed decisions on a patient's treatment. This is supported by the fact that nearly 100% of primary care physicians in Israel use electronic medical records.
That means every patient has an electronic medical record, every laboratory test that is done is recorded, every drug that is purchased is recorded.
It took vision to implement such an innovative solution, enabling world-class measurement of care. So how was this achieved?
It was a combination of several factors. The foresight of some of the system architects here to introduce electronic medical records, combined with the decision of the medical wing to devote the full efforts to actually control the disease, along with the beginning of the measurement and quality performance improvement processes. In one word, what all these attributes allow us to be is a proactive system rather than reactive. The electronic systems allow each doctor to take a look at his entire patient registry and see an updated view which one of his patients is at the highest needs of proactive attention and control.
Even if the patient doesn't come to him, he proactively approaches the patient. He gets alerts, he gets guidelines that tell him which test the patient should do. Has he done them? How well is he controlled? How is his general health? Does he have, or how are his complications developing or halted? Which medication does he get?
For the system to be proactive, it means that a physician should know in real time when the patient has strayed from the optimal disease management plan that he had made for him, and to call him in to take care of that. It's basically an early warning system.
On average, less than 3 months from the first time a patient has been the laboratory test comes out as out of target, that some action is being taken.
A person with diabetes needs to work with their doctor to control their blood sugar levels at or below a target level. Being above target increases the risks of serious and costly complications. When a patient's blood sugar is out of control, action should be taken as soon as possible, such as changing diet or exercise, changing treatment dose or the treatment itself.
Now, the goals are not just glucose control, it's the full picture. A diabetic patient usually has many complex risk factors, usually hypertension, obesity, lipid problems. You look at all those and you also address all those. This results, as has been shown in the literature, in reduction of heart problems, kidney problems, eye problems, feet problems. Each time out of control would translate, we believe, to an impact on the patient health.
In 2019, 2020, we will see at least 50% reduction in both dialysis and blindness in the diabetic population in Israel.
The results in Israel have come about through a commitment to world-class professional education and measurement of care outcomes, among other factors. What has enabled Israel to combine these ingredients of success?
I think that what have brought the change in our country, one of the major things, is our ability to work together. Not to work as many vectors, each one trying to achieve something, but to take all these vectors, to turn it into one vector with several missions that are being done by everybody. In order to make the real change, you need to have the plan, you need to have the support of the government, or at least the support of the Minister of Health. You need to have the support or to work together with the payers, if there are payers in your country. It's very, very important to remember that you have to start with the action. Because if you wait for the money, you'll never do the action.
The achievements in Israel are based on positive steps that are not unique to Israel. So, could they be taken elsewhere? Those behind the changes think so.
Manage your diabetes. Put the infrastructure in the aspects of primary care, IT, and management philosophy or policy, and you'll benefit and do the same things that we do, either at a country level, at a city level, at a region level, whatever you can afford and allow.
There is always room for improvement, but I think by now we have a system that is efficient, effective, and proactive in nature. There is no reason why other systems cannot do the same.